Welcome. Have you ever noticed a pinkish growth slowly creeping across the eye of a dog? This could be Pannus, a chronic and progressive eye condition. In this video, we'll delve into the details of Pannus, exploring its causes, symptoms, diagnosis, and treatment options. Join us as we unravel the mysteries of this canine eye ailment. The exact cause of Pannus, also known as chronic superficial keratitis, remains somewhat of a puzzle. However, the leading theory points to an immune-mediated response where the dog's own immune system mistakenly attacks the cornea, the clear front part of the eye. Genetics play a significant role, with certain breeds being predisposed. Ultraviolet to UV light exposure is also considered a major environmental trigger, exacerbating the condition and worsening its progression. High altitudes, where UV radiation is more intense, can also contribute. Pannus develops through a complex inflammatory process. Immune cells, specifically lymphocytes and plasma cells, infiltrate the cornea. This infiltration leads to neovascularization, the formation of new blood vessels in the cornea, which normally lacks blood vessels. The cornea becomes thickened and opaque due to fibrosis, or the formation of scar tissue. Pigmentation also occurs, causing a pinkish or brownish discoloration that spreads across the eye. Without treatment, this chronic inflammation can severely impair vision. Pannus is most commonly seen in certain dog breeds, highlighting the genetic component. German Shepherds are particularly susceptible, but Greyhounds, Belgian Tervuurens, Border Collies, and long-haired Dachshunds also have a higher incidence. While breed predisposition is strong, Pannus can occur in mixed-breed dogs as well. Geographic location also plays a role. Dogs living in areas with high UV exposure, such as mountainous regions or sunny climates, are at greater risk. The signs of Pannus often appear gradually and can easily be missed in the early stages. One of the first noticeable symptoms is a pinkish or fleshy growth starting at the outer edge of the cornea, closest to the nose. As the condition progresses, this growth spreads across the eye, becoming more opaque and pigmented. The affected eye may also appear irritated, with redness, excessive tearing, and squinting. In advanced stages, Pannus can severely impair vision, leading to blindness if left untreated. Diagnosing Pannus typically involves a thorough ophthalmic examination by a veterinarian. This includes a visual inspection of the eye, often with the aid of a bright light and magnification. The vet will look for characteristic signs like corneal neovascularization, pigmentation, and thickening. A corneal cytology, where cells are scraped from the cornea and examined under a microscope, can help confirm the presence of inflammatory cells. Ruling out other conditions, such as corneal ulcers or other forms of keratitis, is also crucial for an accurate diagnosis. While the traditional understanding of Pannus doesn't have specific subtypes, it's important to differentiate it from a typical Pannus, or plasma cell infiltrative keratitis. A typical Pannus tends to affect both eyes equally and presents with a more diffuse, gray-blue haze across the cornea rather than the typical pinkish growth starting at the limbus. This form is less responsive to traditional Pannus treatments and may require different medications. Treatment for Pannus is primarily aimed at suppressing the immune response and reducing inflammation. Topical corticosteroids, such as prednisolone acetate or dexamethasone, are commonly prescribed to reduce inflammation. Topical calcineurin inhibitors like cyclosporine or tacrolimus help suppress the immune system's attack on the cornea. In severe cases, oral immunosuppressants may be necessary. Lifelong treatment is usually required to manage the condition and prevent recurrence. Protecting the eyes from UV radiation with goggles or limiting sun exposure is also an important part of management. Regular veterinary check-ups are essential to monitor the condition and adjust treatment as needed. While there's no foolproof way to prevent Pannus entirely, especially in predisposed breeds, there are steps you can take to minimize the risk and slow its progression. Protecting your dog's eyes from excessive UV exposure is crucial. This can be achieved by using specially designed goggles that block UV rays or limiting time spent outdoors during peak sunlight hours. Routine veterinary eye exams are also important for early detection and intervention. With consistent treatment, most dogs with Pannus can maintain comfortable vision for many years. However, Pannus is a chronic condition, and lifelong management is typically necessary. Discontinuing treatment often leads to recurrence of the inflammation and progression of the disease. Recent research is focusing on developing more targeted therapies to reduce the reliance on corticosteroids and minimize potential side effects. Gene therapy and other novel approaches are being explored as potential future treatments for Pannus, offering hope for improved long-term management and potentially even a cure.